Hi everyone, my name is Anita Wallace and I'm Chair of the Lymphedema Support Network. And I'm delighted to welcome today Dr. Catherine O'Leary, GP from Oxford, who is joining us for the fourth in our series of our expert question and answer sessions. So welcome Catherine, and thank you so much for agreeing to join us. So this person has asked, why can my GP now prescribe fishing or gardening, but I cannot even get my MLD from the NHS?
Well, that's an interesting question. I myself cannot prescribe fishing or gardening where I am. I can prescribe exercise, which of course is helpful for lymphedema patients. So that is one thing I can do for them. I guess some of this will relate to funding. Some of it will relate to the evidence base behind MLD, and that's not necessarily within my expertise. I guess one of the things I think might make a massive difference for lymphedema and lymphatic diseases is if there was a dedicated set of NICE guidelines for lymphedema. There are some nice guidelines on compression stockings and compression therapy, but there's none just for lymphedema. And I think that might be a real game changer, because nice guidelines are what we use to, they will balance up the benefits and costs of treatments and help us decide which take priority and which do get funding. So I think that might be hopefully something that might happen in the future, and then all these therapies could be weighed up and an assessment could be made as to whether they might, be appropriate to be funded on the NHS.
I mean, in our experience, MLD is only really used on the NHS when carrying out an intensive course of treatment, which obviously includes bandaging, skin care and weight management exercise. And there is strong evidence to support its use. It is very effective. However, for people who would like MLD on a more ad hoc basis, most clinics just simply don't have the funding to do this, or I have to say the time, because of an increasingly heavy workload, with patients. But they will usually teach patients simple lymphatic drainage to do at them home, by themselves, or loved one or a carer. And also the NHS likes to be able to measure how effective something it is, before they'll really spend money on it. And although patients tell us, or quite a lot of patients tell us, that it makes them feel better or it stops their skin feeling tight, the reality is there is little robust evidence to say that it reduces swelling when used as an ongoing treatment. So that is, a major factor of why people struggle to get MLD on an ad hoc basis.
Yeah, and in addition to that, I think hopefully with the spotlight, I think it's being shone more on the lymphatic system now than it has been in the past. Hopefully, already we're hearing about kind of exciting research that's going on, and hopefully with time, there'll be more evidence for effective treatments that can then, be rolled out and funded on the NHS. Yeah. Of course, it's a sort of, there's limited resources, and it's pushing the resources to the most effective treatments at the moment. But hopefully, there's so many enthusiastic people working in the field now that hopefully there will be more and more effective treatments come on stream as time goes by as well.
Lovely. Thank you, Catherine.